Hello everyone, my name is Astrid and her name is Hillary. We are both year 3 students from the Department of Nursing. After our discussion, we would like to share some of our findings on our research article. The topic we are going to talk about is yoga for improving quality of life in women diagnosed with breast cancer. First of all, I would like to begin with the background of this research. Breast cancer is the cancer most frequently diagnosed in women worldwide, even though survival rates are continually increasing. Breast cancer is often associated with long-term psychological distress, chronic pain, fatigue, and impaired quality of life. During breast cancer treatment, about one-third of women experience substantial psychological distress, mainly depression and anxiety, which can persist over years after completion of treatment. Yoga comprises advice for an ethical lifestyle, spiritual practice, physical activity, breathing exercises, and meditation. It is a complementary therapy that is commonly recommended for breast cancer-related impairments and has been shown to improve physical and mental health in people with different cancer types. Next, I would like to talk about the methods of this research. First, types of studies. All randomized controlled trials (RCTs) assessing effects of yoga in women with breast cancer who are undergoing treatments or have completed treatments or both. Both full text and abstract publications were eligible if sufficient information was available on study design, characteristics of participants, interventions, and outcomes. Second, types of participants are women with a histologically confirmed diagnosis of non-metastatic or metastatic breast carcinoma, which is stage 1 to 4. Women with a diagnosis of breast cancer who have completed treatment were also eligible. We applied no limits regarding age groups or settings. Lastly, types of interventions. Any form of yoga was eligible as the experimental intervention. Studies that did not mention a specific form of yoga but simply described the intervention as yoga were also eligible. Interventions included at least one of the following, which are yoga postures, breath control meditation, and lifestyle advice.
For the results, we found 24 studies that involved 2,166 women. Our evidence is current to January 2016. We found that women in 11 studies has completed surgery, chemotherapy, and also radiotherapy. Women in 3 studies were currently undergoing chemotherapy, and women in 5 studies were currently undergoing radiotherapy. Women in the remaining 5 studies were either undergoing treatment or were not. Studies used a variety of questionnaires to assess quality of life, depression, fatigue, and also sleep disturbances. And for the main health-related quality of life, in the intervention groups, it was 22% higher. And for the mean depression in intervention group was 13% lower. And for the anxiety, it was 53% lower. For fatigue, it was 49% lower. And for the mean sleep disturbances in intervention groups were 25% lower. We found that yoga was more effective than no therapy in improving quality of life and also reducing fatigue and sleep disturbances. We are fairly certain that these observed results are probably true. Yoga might be as effective as exercise in improving quality of life and also reducing fatigue, and we do not have enough data to be sure. Studies have poorly reported risk of yoga. However, we found that no evidence of serious risk of yoga among women with a diagnosis of breast cancer. No studies have assessed effects of yoga in women given a diagnosis of breast cancer more than 5 years ago. And for our conclusion, the results suggest that short-term positive effects of yoga compared with no interventions on depression, anxiety, and also fatigue during the first 5 years after diagnosis. Although yoga has positive effects in non-metastatic breast cancer, we cannot evaluate these effects in metastatic breast cancer. And this is our reference. Thank you.